Good day everyone. Today we will be discussing about the drug named aspirin. The main indications of aspirin are pain, fever, and inflammation. It also reduces the risk of cardiovascular death in suspected cases of myocardial infarction and reduces the risk of transient ischemic attacks and to prevent atherothrombotic cerebral infarction. Aspirin comes under the category of NSAID, antiplatelets and analgesics. It also prevents thromboembolism after hip replacement surgery. It acts by blocking prostaglandin synthesis. It is non-selective for COX-1 and COX-2 enzymes. Inhibition of COX-1 results in the inhibition of platelet aggregation for about 7 to 10 days, which is the average platelet lifespan. The acetyl group of acetylsalicylic acid binds with a serine residue of the cyclooxygenase 1 or COX-1 enzyme, leading to irreversible inhibition. This prevents the production of pain-causing prostaglandins. This process also stops the conversion of arachidonic acid to thromboxane 2, which is a potent inducer of platelet aggregation. Platelet aggregation can result in clots and harmful venous and arterial thromboembolism, leading to conditions such as pulmonary embolism and stroke. The most common side effect of aspirin is gastrointestinal upset ranging from gastritis to gastrointestinal bleeding. Hypersensitivity, Ray's syndrome and intracerebral hemorrhage are also observed. Aspirin is contraindicated in people who are allergic to ibuprofen as there will be cross-reactivity. Patients who have asthma should be cautious if they have asthma or known bronchospasm associated with NSAIDs. Aspirin increases the risk of GI bleeding in patients who already suffer from peptic ulcer disease or gastritis. The risk of bleeding is still present even without these conditions if there is concomitant alcohol consumption or if the patient is on warfarin. Patients who have inborn coagulopathies such as hemophilia should avoid all salicylates. Acquired diathesis, as in the setting of dengue or yellow hemorrhagic fever, should avoid the use of aspirin. Patients who have glucose 6-phosphate dehydrogenase deficiency are at risk of acute intravascular hemolytic anemia. Many factors can precipitate these hemolytic episodes. Aspirin is one such known cause. Avoid using aspirin in children who are suffering from a viral infection to avoid Ray's syndrome. Avoid use in patients who have creatinine clearance less than 10 milliliters per minute. May exacerbate uremic GI and hematologic symptoms. Obtain CBC, iron studies, ferritin, stools for occult blood, and liver and renal function tests during prolonged therapy. Monitor for signs and symptoms of hypersensitivity reactions and bleeding. There is an increased risk of gastrointestinal bleeding with alcohol. Aspirin should be taken with food. Thank you. Kindly comment for further queries and doubts. Good day everyone.